Hello. Today on the Leukopak Lady, I discuss some key documentation needs for GMP compliant leukopaks. And as you can see, I'm just not excited to talk about this subject. I wanted to skip it altogether, but even though it's boring, it is an important part of supplying GMP compliant starting materials. Another reason why I decided to talk about this is because it is one of the top areas that developers complain about, that their Leukopak suppliers can't seem to get the documentation right. And I know when I was on the collector side and I was working directly with developers, I learned the hard way that this was an area where many mistakes can be made. In fact, I made more mistakes than I'm willing to admit in front of the 5 people that watch this video series. Everything can go perfectly with the donor, recruitment and qualification, the collection, the processing, and the shipping, but if the paperwork has mistakes or does not capture what is required by developers to meet FDA compliance, then that means the collector failed. And sometimes paperwork mistakes prevent a product from entering a CDMO facility to begin manufacturing. Therefore, this is not an insignificant problem. So think of the set of documents that are collected throughout the entire process of supplying a 21 CFR 1271 compliant Leukopak as a batch record. For the donor, the batch record includes verification of donor identity, a signed IRB consent form, donor questionnaires and physical exam records, determination of donor eligibility and suitability for the collection, and infectious disease test results. For the collection, the batch record includes apheresis procedure record, which lists the date and time of the collection, anticoagulant volume, flow rates, volume collected, personnel performing the collection, and instrument calibration dates. Labeling information should also be meticulously documented, including the product code and evidence of temperature compliance that is dictated by that product code. For the collected product, the batch record includes test results such as complete blood count, flow cytometry, and sterility to demonstrate that the material specifications were met, and also includes any processing records for sampling, product splitting, or cryopreservation. If the collected product is stored for any length of time, either waiting to be sampled or processed, or is cryopreserved and stored long-term, temperature logs should be included in the batch record. Movement of the collected product from one location to the other should also be accompanied by a chain of identity or a chain of custody document to prevent mix-ups, maintain accountability, and ensure proper testing, processing, and labeling of the product. Select information and data from these documents are then recorded on a certificate of conformance or a certificate of analysis that is provided with the shipped product. But before the product is released for shipping or released for manufacturing use, there should be a quality review of the batch record for completion and accuracy, and a signed document to capture that this review took place should be included in the batch record. This is where many of the collection sites fall short. There is such a rush to get the product released and so many records to review that this doesn't get done in a timely manner or is done hastily and fails to catch key mistakes. Finally, all the records completed should be stored together in a physical or electronic format like a chart. So, just follow these 47 simple steps of properly documenting the collection of a GMP compliant Leukopak and you can't fail. So thanks for sticking with me for the last 3 weeks as I walk through regulatory topics important for the collection of cellular starting materials. And starting next week, I'm going to shift gears to talking about why compensating donors is essential to the success of the field of allogeneic cell therapies as a whole. See you then.